Endometriosis affects up to 10% of women in the U.S. It can be very painful and it can have a major impact on fertility. Joining us now to discuss is Dr. Jed Schortz from the Orlando Health Women's Institute. Thanks so much for being here.
Thank you so much for having me. It's a pleasure, an honor.
So let's start at the beginning. What is endometriosis and who does it affect?
So endometriosis is a chronic inflammatory condition that roughly affects up to 10% of the reproductive age female population. And it's a common reason for pelvic pain, which occurs with a woman's menstrual cycle, often outside of their cycle, causing infertility and difficulty for some women to get pregnant.
So once you think, you know what, this isn't normal, I'm gonna go check this out and see what's going on, how do you diagnose endometriosis?
It's a tough condition to often diagnose, and I think that's why for so long, for so many women, it goes undiagnosed. One of the things that we use is pelvic ultrasound, but the tried and true, we say, diagnosis is often at the time of surgery. So it is a surgical diagnosis where at the time of surgery, we can do something called laparoscopy, where we look inside the belly with small incisions. We can see the condition, we can see the endometriosis disease, and the benefit there is it is often therapeutic as well, in that we can excise, or we say resect, endometriosis disease.
When a patient has tried everything else and you've determined that basically surgery is the right course of action for her endometriosis, what happens?
Well, we talk about what's going to be the right surgery for them, whether it be something more definitive, or if we're talking from a fertility standpoint. When they come in for surgery, we're able to do it through robotic and laparoscopic surgery. So what happens is we make several small incisions on the belly, and then we're able to place instruments within the abdomen and operate using those instruments to ultimately achieve what the goal of surgery is.
And many times your patient can go home the same day.
They can go home the same day. A lot of patients have a much quicker recovery, that they're able to get back to their daily activities quicker, get back to their life quicker. And especially with these techniques, it decreases the risk for certain things that we think about, like infections and blood loss, and really yields, we find, better outcomes, long-term outcomes. It's just a world of difference. They're finally pain-free. They can get back to taking care of their loved ones, their spouse, their children, and they'll often say their life was saved from that surgery.
And they get to bring a beautiful baby into the world. It's another reason to choose well with Orlando Health. And if you would like more information, you can visit orlandohealth.com/women.